Today on Nursing Stories, Nurse Jean faces a mystery written in blood. Nursing students, in 3 minutes you'll learn how to read a CBC in a patient who has an infection and who is bleeding. In doing such, you will learn how to interpret your patient's H&H, spot the dehydration trap, use the CBC to detect signs of infection, and provide appropriate nursing interventions. So, let's paint the scene. Nurse Jean is taking care of Mr. Bob. Mr. Bob has just gotten into a motor vehicle accident and he's bleeding from his wound on his leg. She will get vital signs every 4 hours. She knows a person's blood pressure and heart rate gives her immediate insight to that person's volume status. And their temperature gives her immediate insight to their infection status. The provider orders a stat CBC, typing cross, to prepare for blood transfusion. His vital signs show tachycardia and low blood pressure. When blood volume drops in the body, the heart rate increases. Nurse Jean knows the heart rate is elevated when a person has a fever. Nurse Jean expects his hemoglobin to be low and for him to report feeling tired. Remember guys, chronic blood loss from things such as heavy menstruation or heavy cycles can do the same thing quietly over time. His labs come back, low hemoglobin hematocrit and elevated WBCs and neutrophils. She knows to avoid the dehydration pitfall because dehydration can make the H&H look high. Patients don't have more red blood cells, they have less water. Remember guys, always read the H&H in context of volume status and the story in front of you. Mr. Bob's wound is infected as evidenced by his fever and his CBC revealing a left shift. She is sure to collect a wound culture before starting antibiotics to identify the right pathogen. And prompt treatment with the antibiotics prevent Mr. Bob from becoming septic. So how does Nurse Jean save Mr. Bob's life? She maintains pressure to the bleeding site and start IV fluids. She prepares him for a blood transfusion. Since an infection is suspected, she draws cultures before starting antibiotics when feasible. He has an open wound. She will check his tetanus status, and if it's been greater than 10 years, she will give him a booster. She will do this once he is stabilized. Quick check, guys. Answer these out loud. If you have a patient who hemoglobin is low or actively bleeding and a soft blood pressure, what's next? You want to first stabilize with IV fluids and transfuse packed red blood cells. If their H&H is high, but the patient looks dry, you want, what's the trap? The dehydration pitfall. When their WBCs and neutrophils are elevated with a left shift, what do we suspect? An infection. You want to collect cultures and start antibiotics. Read the CBC like a story and let the story guide your care. You've got this. Be sure to follow me for more nursing stories that make clinicals make sense.